More adults are seeking autism assessments at any point in the past, and many of them have spent years being told what they're describing is things like anxiety, depression, maybe ADHD, maybe even a personality issue, or simply it's just who they are. For some people, it's one of those things that they don't understand. For others, autism is part of the picture, it's never been named. I'm Dr. Max Malik, I'm a consultant psychiatrist, and one of the areas I assess is autism spectrum disorder in adults. Why adults seek autism assessment? Well, people come for autism assessment for a range of reasons, really. Some have always sensed they were a bit different, experienced the world differently, and they want to understand why. And just know that some have found strategies that have carried them through school and early adulthood, and they no longer work these strategies. But after a change in job or arrival of children, a relationship breakdown or burnout episode, they can become decompensated and have difficulty coping. Some come because a child has been diagnosed and the parent recognizes some of those symptoms in themselves or difficulties. Women in particular are often diagnosed late, and that's partly because women historically have been less well recognized, and many autistic women become highly skilled at masking, so they adapt their behavior to fit in social norms and expectations, and sometimes that comes at a personal cost. What a thorough assessment looks like in an adult autism assessment should never be a checklist. It's never just a tick box exercise. It's actually a detailed clinical history process that looks at the whole of someone's life, right from birth, childhood development, school years, work, relationships, sensory experiences, communication styles, interests, routines, and how all of that dimensional jigsaw fits together. So I take a comprehensive developmental, personal history, which is ideally supplemented by an account from someone who knows you in childhood. And this is really helpful because then I use structured, validated assessment tools alongside these, and I look carefully at the differential diagnosis, because in this aspect, psychiatry can be complex, and things such as ADHD, anxiety, trauma, personality presentations can often overlap with what looks like autism and do need to be separated out to have a meaningful diagnosis. The aim is not to label, it's not to dismiss, it's to arrive at a considered, accurate understanding of how you experience the world, what a diagnosis can mean for you. And for many adults, a diagnosis is not the end of a process, but the beginning of one, because it then starts to explain things like why they've spent decades trying to account for the differences and how they don't sometimes make sense of the world, or why other people don't understand them. Certain environments can be really exhausting, and certain interactions feel costly, and these internal experiences have never been able to be fully understood. It can also open practical changes, for example, at work, in relationships, in how someone structures their day, and that can significantly improve quality of life. It also allows other conditions, if they're present, to be treated more accurately, because autism and other conditions often go together. In fact, it's very common. And so, what if it isn't autism? Well, that's okay, because a good assessment should be honest. Not everyone who seeks an assessment meets the criteria for autism, and one of the most important parts is being clear and saying if it is or if it isn't, and sometimes there may be something else, like, for example, ADHD. Sometimes it could be trauma after a difficult childhood, sometimes it's anxiety, and that's shapes the way we are in our social experiences, can resemble autism, but isn't sometimes. So either way, a good answer management plan is really important. If you'd like to discuss adult autism assessment, please contact the Health Suite. I'll spend the time it takes to do the assessment properly and leave you with a clear, written report, a conversation, and a good management plan personalized to you at the end.